بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. اللهم أخرجنا من ظلمات الوهم وأكرمنا بنور الفهم وافتح علينا بمعرفة العلم وسهل أخلاقنا بالحلم. اللهم ارزقني نعمة الإخلاص لوجهك الكريم بكل ما أقول وبكل ما أفعل. آمين يا رب العالمين. My topic today is about back to the basics, chest X-ray interpretation. In this part 1, I will talk about the indication and the technique of chest X-ray. The chest X-ray is the most frequently requested X-ray at the radiological department. Here are some indication of the chest X-ray, but not all of them. This is a primary indication to exclude or confirm lung pathology, including overfilling, coma, pneumonia, and pneumothorax. In addition, it provides information on inserted lines and the tube like deep venous lines, tracheal tube, gastric tube, heart and vessels, cardiomegaly, aneurysm, mediastinal lymphadenopathy, ribs, and soft tissue like subcutaneous emphysema. And also it is routinely used as a medical checkup and screening in the old age group for lung cancer or metastasis. Technique: we have some, not all of the technique I will discuss here. I will discuss some briefly. The posterior-anterior posterior-anterior view and anterior view, lateral view, inspiration and non-rotation and ventration in the technique. I will discuss these 6 points very briefly. Posterior-anterior image or view: the X-ray passes through the body of the patient, back of the patient, from the posterior to anterior, and the patient is standing on with his abdomen and chest against the X-ray film, and the arms are on the lions or in the hips. As we see here, the X-ray coming from the back to the anterior, and the anterior is, the heart is anterior structure, so there is no magnification of the heart. And the arms are, it is on the lions here to give away over scapula away from the chest wall. Anterior-posterior view: the X-ray passes through the body from the anterior to the posterior, and the patient is either sitting or lying with his back against the X-ray plate or X-ray film. As we see here, the X-ray, it is coming from the anterior to the posterior, and patient is lying on his back, and the X-ray film is back or posterior to his back. And here we see the heart, it is anterior, and there is some magnification in the heart shadow in this view. And this is usually used in portable patient or in patient cannot stand. Lateral view: the X-ray beam passes through the body from right to the left according to the conviction, and the patient either standing or sitting with his left chest against the plate. Both arms are lifted into the air to prevent overprojection of the arm. As we see here, the patient is on the lateral side, and usually we do the left lateral. Why? Because the heart will be in close to the X-ray film, and there is no magnification to the heart, and the X-ray it is coming from the right to the left, and the hands it is up to prevent overshadowing in that area. Inspiration, we should take a liquid inspiration, and during the taking the chest X-ray. How we know that it is good inspiration? When we see 10 dorsal ribs or 5 to 7 anterior ribs across the diaphragm at the mid-clavicular line. And to distinguish dorsal and anterior ribs, the horizontal ribs are the dorsal side or posterior one. As we see here, this is the anterior rib, 1, 2, 3, 4, 5, 6, 7, and the posterior ribs, it is the posterior ribs. These are the posterior ribs, and we should count at least 10 posterior ribs in order to call this inspiratory view. Non-rotated, we should also put the patient in central position without rotation. In non-rotation image, the spinous process of the thoracic vertebra project in the middle between medial ends of the clavicles. As we see here, this is the medial end of the clavicle, and these are the spinous process. And the distance between the medial end of the clavicle and the spinous process from either side, it should be equal. If it is increase in that area, it is rotated, or it is increase in that area, it is a rotated patient, and will give some pitfalls and error in diagnosis. Penetration refers to the amount of radiation passing through the body. If too much or too little radiation is given, the resulting image will be either black or white. Chest X-ray with good penetration, we can see through the heart and see the contours of the thoracic vertebra. And here nowadays we use the optimized setting for the penetration, and we use the digital machines, and there is very good. It is very good, and there is no over penetration in more than 99%. Thank you very much for listening, and hoping to see you soon in another talk. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك.